So what he really needs is the traction this way. Good, so we got one already. Good. Good, moved, awesome.
Hi, my name is Jonathan. I may look like I'm 30, but I'm 19 years old. And I've got a thing called Charcot Marie Tooth Disease. Just goes by CMT. It's just a progressive nerve issue that affects how the nerves travel to my legs and hands. We always knew there was something wrong. When I was little, I had a difficult time walking on my heels. And then we had a nerve test when I was 17 and found out that it was CMT. I hope to achieve just to feel better about myself, more confident. The more aligned I can get, I think not only will that help my walking, but it'll transition up my body and help some back pain that I have.
All right, so when we were doing all the muscle tests with Jonathan, we found that when he was trying to hold his fingers out and keep them out, one, you'll see a little bit of the shake, and that's part of the CMT, which will affect primarily the extremities. So you'll see it in the feet a lot, and you'll see it in the hands a lot. But there's a little bit of a shake, and then also has difficulty holding them out. So I'll let you watch right now. We'll start with the right hand. So already there, the little bit of the tremor and the shake. And then as we go to bring the fingers in, so not much strength here, not much strength there. Strongest between those two. All right, so strongest between the pointer and the middle finger. We'll do the same thing on the left side. So hold it out. I'm gonna try to bring them in. So here, not much. Here it gets a little stronger. And then here's probably the strongest. So this would be full 5 out of 5. 4 out of 5, 3 out of 5 on the widest too. All right, so this is Jonathan here. This is actually gonna be the second day of adjusting him. We've set him up on a plan where we're seeing him 3 times a week for 2 months until he goes back to school. And while he's here, we're gonna be adjusting him twice. So I'll check and adjust, let him rest for about 20, 30 minutes, and then check and adjust him again. So this is close to a healing immersion that we also do at the Source. Healing immersions are typically anywhere from 2 to 4 times a day, up to 5 days a week. And so I'll just show you some of the things that we are gonna see right off the gate. And so if you come around this way, one is he has increased arch in both feet. And this is one of the signs and signals that you'll see with CMT as you watched his squat. He has an inability to keeping the heels on the ground. And actually in the first squat that we have on from the iPads was also dropping the arms down right away. And that is partially due to the incoordination or weakness that he'll feel in the legs. Now the weakness is kind of a byproduct of the muscles constantly firing. So yesterday, I actually was watching his calf muscle being in constant fasciculation or muscle spasm. It actually looks better today. So we adjusted him yesterday, and now we're checking him today. So even as I go to pull on the heel, you got, decent Achilles tone, calf tone, a lot more restricted on the left side. And so it feels like it's really anchoring in here. Again, so the nerves are firing in excess, which will make the system feel tired. So it's like it's a combination of like tired, tight, and weakness. Is that correct, John?
Yep.
Yep. So the beautiful thing is Jonathan's in a good place to heal. He's ready to heal. He's open to healing, and I've come to know that that's part of the battle, right? Are you open to it? Are you willing? Are you ready? So we're gonna start here. We got a T7, T8 adjustment. Go ahead and take a breath in. Let it out. I'm just gonna follow him in, let it go further. Perfect. Good. It was adjusting and her opening up even on the setup, so we were in a good placement. Checking the pelvis. One of the things I noticed from adjusting him the first day was there was a lot of suboccipital tension, which is a sign of cord tension. And upon evaluation of the report of his x-rays, we do know that he has some degeneration between L4 and L5. So cord primarily attaches, occiput C1, C2, sacrum, and coccyx, also known as the tailbone. So go ahead and go this side up for me. So I would say actually, at least in this moment, the calf spasm is a lot better. Have you noticed that throughout the day, or is that more just kind of different moments of the day it can change?
Yeah, it's definitely pretty inconsistent, but it feels better today than it was a couple days ago.
There it is. So let's see if we can keep that trend going in the right direction. So we're gonna be adjusting his sacrum here, And then we're gonna bring the sacrum slightly downwards. So take a breath in, let it out, right there. Perfect, go face up. So the way we adjusted that was primarily creating space in the L5 and S1, our sacrum. Moved well, felt the tension kind of travel up. When you also mentioned that you roll this ankle a lot, right? Like pretty much every 2 days. And so you can come now here, you know, when you actually go to bring the foot out in this direction, you can tell that this ligament has been sprained quite a bit. So it's really loose. And then you also see you got the large bump here, right? And these are the cuneiforms that have gone more, you would say, superior instead of drop down inferior towards the feet. And so we gotta be careful when adjusting the foot because you're already hypermobile there. So meaning move too much this way, but we wanna be able to start to bring him into greater supination, or I'm sorry, a pronation of the foot. So going down into the ground this way while not making sure to stress this ligament. So we're gonna adjust the foot, bring him in slight dorsiflexion, getting that roll. See, I already wanted to move, that's awesome. So what he really needs is the traction this way. Good, so we got one already. Good, and the rest would cut, oh, there was the secondary release coming out towards the toes. So we check the same thing, not as bad on the left side, but again, what we wanna do is roll in. Good, good. Yeah, so it's interesting, you get the impulses and then it releases in the distraction, okay? So feeder, so that's one of the things that we're gonna wanna track as we continue moving forward is how are the feet doing? Does he have an ability to keep the foot on the ground as he squats, which will give him more grounding, more stability, more strength. Had an awesome adjustment on the occiput yesterday. It's feeling actually really nice. We're gonna adjust C1 right underneath on the right side. So sliding off the occipital ridge. C1, we're gonna drop it down. Good, moved awesome. And then C2 and C3 are slightly posterior as well. So we're gonna bring it up this way. Nice. All right. There it is, come on up, Jonathan. There you go, brother. Sweating, yeah, it's also a little warm in here. But that's one of the things that can happen following adjustment is the perspiration as we get releases. And so we wanna be following him every week, giving updates, watch how he walks, watch how he squats, kind of just be like a live case study and excited for where we can go. You ready? Yeah, brother. Boom.